So thanks for helping us out by doing this. So Kevin, we'll just go through your medications again. You've got them packed up here. It's like there's not too many here. There's about 4 or 5 regular medications plus a few other bits and pieces that we take. So,
yes.
So the main thing that you mentioned that we started off with a minute ago is that you've had some gastric banding.
Correct.
And as a result of that, where you've lost 30 kilograms. And how long has that taken?
Well, most of it's happened in the last 12 months. I had the banding done something like about 8 years ago.
Okay.
But I stopped using the band, shall I say, for some time.
Yep.
Through my own pig-headedness.
Okay.
But now I've gone back to it, and most of it has come off in the last 12 months.
Well, that's good. It's 30 kilos in 12 months. I mean, you obviously you can lose weight too fast. So obviously doing that at a reasonable rate is good. And you're saying the surgeons also added the carbos as part of that.
Yes, I mean with the banding you tend to eat a lot of very soft meals.
Yep.
And amongst those soft meals, of course, there's a fair amount of things like potato, mashed vegetables, etc. And they do contain a bit of carbs, so that was one of the reasons behind it.
Okay, good. It's obviously working well. And as that happens, are other things improving as well? So you mentioned your blood tests were all good. So
yes.
cholesterol,
and, blood pressure is maintaining a very good level.
Okay.
I have to have blood pressure tablets.
Yep.
At times I have had breaks from those because the blood pressure has actually dropped a little bit.
Okay.
No, it's been fantastic.
You might find that once you lose another 20 or 30 that you can actually stop those, because it's a very common thing. In fact, somebody told me once that if everyone in Australia lost 4 kilos, about 20% of all diabetes would just go away.
Yes.
So it's a good thing that you're doing for yourself. So that's good. So obviously one of the consequences of your previous weight has been some of the joint problems. So you mentioned you had knee problems.
I was very heavy, and also I played quite a lot of contact sports, football, rugby, etc. And did a bit of damage to the knees.
So at the moment you're on the Panadol Osteo 4 times a day plus the Moxicam?
Yes.
And they're the only things you're using for your pain?
Yes, they are. I have been told that I need knee replacements, and they wouldn't do it because of my weight. So we're now looking forward to the day when the weight comes down and maybe.
What's their cut-off?
There's no cut-off. Just I go back and see the specialist again when I think the weight's in level.
Okay, so how's your pain control with that combination?
It's been better with the Panadol Osteo, but it is still pretty bad at times. There are times I can't walk.
Okay.
But they sort of tend to.
And the Moxicam, you've been on the Moxicam for a while, or
for a long time? Yeah,
long time?
I was on another tablet which was withdrawn from the market after a
Vioxx.
Yes, that's the one.
Yeah.
And that was put onto the Moxicam from that point.
Right.
I don't think it's been as good, but it
There's a few others around that are similar to the Vioxx. And you can actually get the Vioxx if you get a special permission from Canberra and all that sort of stuff. But it's a risk-benefit thing. Obviously, they took it off for a reason, so it's a matter of sorting that out.
I also take it for my back.
Yep.
Which is, I think the neurosurgeon said, if I did anything with your back, I wouldn't know where to start. It's such a mess. So at the moment, he's recommending physio and hydrotherapy just to try and.
Okay. So, but again, the weight loss will help that a bit. Okay. So there are still days where you can't walk.
Still days I have a lot of difficulty walking, a lot of difficulty with the back.
Yeah.
But the Panadol Osteo has helped me overcome it.
So on those days that you might have say you got up tomorrow and you had a really bad thing, would you do anything different with your? Is there something else you could do? You got other medications or?
No, I haven't taken anything
Right.
else.
Okay.
I just sort of tend to take the osteoarthritis works and work my way through.
Work your way through it, right? Okay. Because obviously there's lots of stronger medications, and it seems like your stomach at least can tolerate the Moxicam quite well. Like most men, you've got a tougher stomach than other people. So it may well be that we can either change that one or increase the dose of it.
I did have Panadol for all day,
yep.
but I find it has an effect on me of making me a little bit out of this world. And,
the codeine in it is strong.
I'm known to the fact that if I go to theatre or something, they'll give me 2.5 grams of Valium where everybody else has 25.
Yeah.
I'm quite happy.
Yep. That's all you need. So sensitive, a sensitive new age man. That's what I like to see. Okay. So if you, on the days that you don't have the bad days, how would you rate your control of your pain? What, if we said 10 was terrible and 0 was good.
I suppose on good days,
yeah,
it's somewhere around the 5 or 6 mark.
Yeah.
It's always there.
So it's still not ideal.
It never goes away.
Yeah. Okay. All right. Okay. So it's also worth, if you are going to be long term on drugs like the Moxicam, it's probably worth also checking for this H. pylori that I talked about before. Because if you've got that, it increases your risk of problems. If you don't have it, it reduces your risk, and getting rid of it's pretty easy to do. So that might be something that we'll talk about from that point of view as well, just in case. So, and you're also taking vitamin D as well?
Yes, my GP said that one of the many Tasmanians who doesn't get enough sun.
It's about half, including pharmacists and GPs.
I love the sun, but
yeah, it's funny. You can spend as much time out as you like. It seems like it doesn't seem to make too much difference in winter. I think they're saying Tasmania in winter you have to be out there for an hour with your face and hands uncovered. In full summer it's only 10 minutes or so. This is but an hour per day. Most people don't get that.
Don't get that this time of year.
Yeah, well this time of year you wouldn't leave your face and hands uncovered anyway. It's too bloody cold. That's it. The last one you got down is the Paxtine. The Paxtine, which you're having 2 in the morning again.
Yep.
And has that been long term?
Very long term.
Yeah.
That was prescribed when my wife's illnesses came about.
Yeah.
We both got very depressed with the world.
And you're caring for her as well.
I'm caring for her, so they suggested that I needed something to keep me going.
Has it helped?
Yes, it does. I mean, if I don't have it, I know I haven't had it.
Right. Okay. Well, that's good. That's a good sign. No problem sleeping with that?
No, I don't have a great deal of problem sleeping at all.
Another male thing, obviously. That's right. Okay.
With age, I tend to get up a little bit more during the night, but that's
Yep. Yeah, that comes to all of us too. Don't worry about that. It's starting. All right. Well, look, it looks pretty straightforward. I mean, the main thing is to, again, try and improve your pain management. And there's certainly a number of other medications as well. I mean, we'd probably still leave you on the osteo as a baseline treatment.
Yes.
And maybe try and change around which of the other drug is more for the inflammation. So that might be a better option. Obviously, if we eventually get the knees replaced, then that's a much longer term option. But that's something that we can look at as well. And given that we're going to have to be on something like this, testing and reducing your risk of having to use it, that would be a good thing. Sometimes there's a lower dose of Nexium, for example, that sometimes people take just to cover. It's like we call it, just to make it a bit safer. The combination of Nexium and that actually makes it less likely to cause any problems.
I used to have a different medication for the arthritis, and that upset me. I know there was something they gave me.
Yeah.
I think it might have been Rani or something at that time, but I used to have to take one with the other.
Yeah, that's right. It's a common thing to try.
Different.
Yeah, these are a bit safer than the older ones, but a bit safer doesn't mean it's totally safe. It's a problem with all medications. They've all got their own problems. The vaccine, I don't think we'd do anything about. I think the weight loss will improve a number of things. You might be able to, as we said, look at maybe changing your blood pressure medications downwards further as your blood pressure continues to fall.
That will go along.
Which is all good, because obviously the lower your blood pressure is, the lower your risk is of all sorts of other issues.
Okay,
well, it's part of it is possibly the direction you're going with your weight loss is improving all of those things, because that's it's one of the best things you can do for your body in terms of taking the load off your heart, off your joints, off your pancreas, all of those things that are working to try and keep it all going.
I must admit that my weight loss surgeon is actually pleased with me, which is a step in the right direction.
Okay. So he's talked about, there's also, more recently, there's medications that you can use to help with weight loss as well. It doesn't sound like you need them at this stage.
I think he takes a view that whilst I'm losing gradually, we'll keep going.
Absolutely.
If I plateau and stop, we'll look at other things, and that's what happened with
it. Depends where you plateau and stop. That's the thing.
We've been going along quite steadily at the sort of 3/4 of a kilo a week type, half a kilo.
That's perfect.
Lately, so he's quite happy.
Yeah, in fact, if you lose quicker than that, it's more likely to be fluid or something else.
Comes back on.
That's right. So that's a great rate. So
I'm hoping to get to the point where the weight comes down to the point where I can walk around and get a bit of exercise.
Yeah.
That'll make it come up
even quicker. Yeah, that's right. Okay. All right. Do you smoke?
No, I gave up smoking 21 years, 4 days, 6 hours ago.
That's right. Go back to it like that.
I gave it up after 25 years of it.
Yeah.
And then it was about a bit over 20 years ago.
Okay, good. And still crave it, or?
No. Actually, I abhor it now.
Yeah. That's a fairly common story from ex-smokers.
Reformed drinker.
Yeah. I haven't got to the stage where I'm a reformed drinker yet. I'm still not reformed. So that's good. All right. Well, thanks, Kevin.
Okay.
That's basically all we need.